Well, the reason I really started the program was because blood sugar levels were just, I mean, they're up and down all over the place. I really couldn't control them at all. Some days they'd be normal, some days they'd be 180, 190. Since I've been on the program, fasting level has been under 100 from almost from the time I started the program. So
yeah.
That's been a big help. I think I'm most happy about is the fact that the blood sugar levels have been stable, never going over 100. So
now, was that something in the past before you were in the program that was hard to do? Is that something that for you was a struggle?
Yes, even no matter how many pills I was taking, it was still, and I was at the maximum number of pills to be taken.
You mean your medication for blood sugar? Yeah.
And it's still, some days it would be fine, and then the next day it would be very frustrating because it would be, you know, 30, 40, 50 points higher than it was the day before. But that's changed since then. Since I've been on the program, like I say, it's never been above 100, which is, you know, for me is a big, significant step.
Yeah, absolutely. Now, yeah, and that's great. Now, is this the first time you've ever had an improvement as a diabetic? Like over time? Over
a long period of time, yeah. And it's been about 2.5 months now. And, right, it's never been, this is the longest period it's been, you know, as stable as it's been. So
that's great.
Yeah, so it's been significant. Yeah.
That is great. Now, there's people out there just like yourself when you first came in that are skeptical. They don't think that there's something you can do about diabetes and improve your A1C without medication, and they think it's impossible to do anything and what have you. And you're one of those guys that was determined, you know, that we look for, that we want to make sure there's a good fit. But if someone was out there and they were suffering like you were prior to the program, what would you tell them? Would you tell them that this is something that works, or what would you say?
Well, it certainly worked for me, and I was skeptical, but I was also at the point where nothing else was working, so I was willing to try anything, and I've seen the results. So you know, I'm so far very satisfied with what's going on. I mean, my A1C now is down to 7.1, which I don't think it's ever been even close to that in the last 15 years that I've been a diabetic. So
that's incredible.
that's a good sign.
Yeah.